In today's lecture, we want to look at local anesthetics or drugs used for anesthesia. We know they are categorized into two, that is local and generalized anesthetic drugs. So in this video, we want to look at only local anesthetic drugs. And as we begin, we always remind you to subscribe if you haven't, like the video, and share the comments under the comment section. So we want to see what is anesthesia, you can ask yourself. So anesthesia, that is like sedation or depressing. So here it is temporary or loss of pain or loss of consciousness. So many times before surgery or before any traumatic work on the patients, we normally give them anesthetic drugs to prevent pain. So we are seeing these local anesthetics, these are drugs which are used which makes loss or temporary, it can be temporary. So it is temporary loss of sensation, temporary loss of sensation due to inhibiting of the propagation of action potential. When there is no action potential in the axon of the neuron, we cease to respond to the stimulus due to pain. So loss of sensation, it can be temporary loss, but this one occurs at a localized area. This one occurs at a specific site or localized region. That is why we are calling it local anesthetics. So these drugs, when given, they act at the site of administration. They do not undergo the general CNS sedation. So these are local anesthetics. After seeing what they do, whereby they prevent sensation at the localized area, they work through fibers, and these fibers, they carry what we call thermoreceptors, mechanoreceptors, and pain receptors. And the ones responsible for pain they are the ones to first respond. Fibers are the ones which are small and myelinated. So neurons which have myelin sheath and they are small in diameter, they respond faster to these local anesthetics compared to wider neurons together with myelin and myelinated. And we are going to see that these fibers, the first to respond is C, followed by B fiber, followed by A delta fiber. Then lastly, we shall have A alpha, beta, and gamma. So this is the sequence of their potency. The first one to be fired or to be blocked, this is the sequence of blockade. So the first one to be blocked by these local anesthetics is fiber C, which is these are sensory neurons. These are sensory fibers which are taking the information to the spinal cord. Then from the spinal cord, they are transmitted to the thalamus part of the brain. And in the thalamus, it is taken to the cerebral cortex where it is interpreted. So whenever there is any trigger or any stimulus of pain, either you have touched in fire or in a needle prick, the pain receptors, they are the ones that transmit information to the spinal cord, that is in the dorsal horn. And after being taken to the dorsal horn, they are transmitted to the thalamus part of the brain and then to the cortex for perception. So we are seeing these anesthetic drugs, they come and block these fibers, sensory fibers. So these sensory fibers, they are blocked by these local anesthetic drugs. And how do they block it? That one leads us to the mechanism of action, whereby they act. This is sodium high voltage gated channel. This is outside of the cell where we find much of the sodium. So we see much of the sodium ions are found outside the cell, and under under polarized state, outside the cell is positively charged and inside the cell is negatively charged. This is what we call polarization. And then when an impulse arrives into this neuron, what happens, it makes opening of the gate of the sodium ion gated channel, leading to influx of sodium ions inside the cell. And when sodium ions enter inside the cell, then outside become negatively charged and inside positively charged. And this is what we refer to as depolarization. Depolarization. And when this one sum up to reach the action potential or to reach the threshold, it is an impulse is fired, or it is the action potential is propagated. So this is the normal action of these neurons, which we have seen the sensory neuron CB, A delta, then A alpha, beta, and gamma. So when we take these local anesthetic drugs, what happens, they come and block the opening. We saw when an impulse arrives, the gates open, allowing influx of sodium ions inside the neuron. So what happens, these drugs come and close or block the opening. So these drugs act by blocking, they block the opening of sodium gated channel, of sodium high voltage gated channel. Hence, the end result, when we block the influx of sodium, the inside will not become positively charged and the action potential will not be fired. So this one will lead to, it will stop propagation of action potential. And when action potential is not propagated or it is not conducted, the pain cannot reach. So if we block these receptors at this point, the impulses will not reach the spinal cord and will not reach the thalamus and will not reach the cortex. So you cannot perceive that there is pain. So that is the mechanism of action of these anesthetic drugs, which act by blocking the opening of high voltage sodium gated channels, hence impeding the propagation of action potential, which enables transmission of impulses to the CNS for interpretation, that is the cerebral cortex. So after knowing how they act, now we are going to see different classes of local anesthetic drugs. And they are classified in two, whereby we have the esters and amides. These ones, they have an ester bond connected to the hydrocarbon chain. These ones, they have an amide connected to the hydrocarbon chain. And examples of esters we are going to see, but before we look at the examples, we are going to see the properties or the factors that enable quick absorption of these local anesthetics. So before we begin this, we can look at that at this point, whereby these local anesthetics, they are enhanced by alkaline pH, they are affected by pH of the media, then they are affected by pKa of the drug, then they are affected by the size of the fiber or the sensory fiber, affected by the presence that these drugs should be lipid soluble. So they are affected by lipid solubility. That's why we see the myelinated neurons transmitting faster or blocking faster. So these are the factors that affect the transmission of these impulses or that affect the action of local anesthetic, that is pH, whereby these drugs are well absorbed and act in an ionized basic form. So meaning when the pH is higher than the pKa of the drug, meaning it will easily be absorbed. For example, if a drug has a pH of 8.6 and the pKa of the drug is 6.0, this one will act faster. the action is faster because the fraction of an basic and ionized form is much. So that is what we are talking about. So for beta action, the medium where you are applying this drug, the pH should be higher than the pKa of that particular local anesthetic. Then we said the size, the smaller the fiber, the faster the transmission or the blockade. Then also lipid solubility, that's why we see myelinated blocking faster compared to non-myelinated neurons. So after seeing that, let us look at the different classification. And these esters, they are degraded in the body to produce PABA metabolites. And this degradation is done by enzyme known as pseudocholinesterase. Is the enzyme that breaks down the ester bond and releases PABA as a metabolite. And this PABA released due to action of pseudocholinesterase enzyme in the body. It is the one that brings about allergic reaction or hypersensitivity reactions. So allergic reactions caused by esters is due to accumulation of PABA metabolite after being degraded by this pseudocholinesterase enzyme. And that's why we shall end up saying that these esters, these drugs, they are short acting, and they are less potent compared to the amides. And examples of these drugs, we are going to see these drugs can be classified into three, whereby we have the short acting, we have the long acting, and the superficial. Those which have short action, then those which have long action, and those which act superficial. And examples of these drugs, the drugs that which are short acting, we have procaine. Procaine is short acting. Then the long acting is tetracaine is long acting. Then the ones which are applied superficially, we have cocaine. Cocaine is given superficially together with benzocaine. So cocaine and benzocaine, and we shall see some good things about cocaine, but benzocaine, its side effect when taken, it produces O-taurine, and this O-taurine oxidizes the iron in the hemoglobin from iron 2 to iron 3, leading to what we call methemoglobinemia. This one causes methemoglobinemia. So when you're asked in MCQs or in multiple choice questions that which of the following ester drugs cause methemoglobinemia, and this methemoglobinemia leads to cyanosis. This one can lead to cyanosis, whereby you find the palms become bluish due to lack of oxygen. Because when this benzocaine oxidizes iron 2 to iron 3, it loses the ability to carry hemo-oxygen to the respiring cells because methemoglobin cannot bind to oxygen molecule, leading to cyanosis. So the peculiar drug under esters, that is benzocaine. Then under amide, we shall see procaine as a drug that do that. Then we are going to talk about also cocaine. This cocaine, which is superficially acting. Cocaine, for it is given superficially, and it is less potent. It is less potent, and it has ability to cross the CNS. It acts in the central nervous system. How it acts by blocking reuptake. It blocks reuptake also. Apart from stopping conduction of the action potential, this procaine also inhibits reuptake of norepinephrine and dopamine neurotransmitter. And when these neurotransmitters are not taken, it can lead to sedation. The end result is sedation. The effects of this blockade of reuptake can result into sedation. It can result into euphoria. That's why it is a drug of addict. It brings about excitement. It brings about anxiety, and so forth. That's why we apply it superficially, not in the intrathecal or epidural. So after seeing that, and we have said among the esters, the only long-acting is tetracaine. Tetracaine is the only one which has longer half-life and it is long-acting, anesthetic. Then procaine is short-acting. But among the side effects, as we shall see here, procaine can cause hypotension. We shall see it can cause hypotension, cardiac arrhythmias. And we see these ones are also vasodilators. All local anesthetic drugs are vasodilators except cocaine, because cocaine is the only one which is a vasoconstrictor. It is also important to note as a student that among the all local anesthetics, only cocaine is a vasoconstrictor, and only it is the one that inhibits reuptake of norepinephrine and dopamine. Very important to note. Then after that, we can look at amides. Then we shall come back to the side effects. Then the amides, they are also categorized in different ways, whereby we shall have long-acting. Under amides, we can have those ones with long action and those ones with intermediate, with medium action. And those ones with medium action, we shall see a peculiar example of lidocaine. Lidocaine, you can call it lidocaine, or it is commonly known as lignocaine. Then among the long-acting, we're going to have example of drugs like dobucaine, we shall have bupivacaine, we shall have ropivacaine, and mepivacaine. So these are long-acting, but among all these ones which are long-acting, the one with highest potency and longer acting is dobucaine. Dobucaine is the one with the longest potency. This one is the one with the longest potency. So if they ask you among the amide which one have the longest potency or mode of action, that is dobucaine. And these drugs, they are used in local anesthesia. They can be given parenteral, they can be given orally, they can be given intrathecal. But their major problem is that they cause cardiotoxicity. They cause cardiotoxicity, especially ropivacaine. Ropivacaine followed by bupivacaine. They cause cardiotoxicity, so contraindicated in people with hypertension, because these drugs can cause cardiac arrhythmias. Because they are vasodilators, they can bring about hypotension and even ischemia, heart injury. So they are contraindicated because of their cardiotoxicity effect. Then mepivacaine, for this one, is contraindicated in pregnancy. Contraindicated in pregnancy. So if someone is pregnant, because this one has a toxic effect on neonates, this one has toxic effect on neonates, so it is contraindicated in pregnancy. And another thing we can look at, there is one drug which I've left behind, but we shall bring it here. Then another thing we can see that they have half-life between 2 to 4 hours. We have seen the one which is contraindicated in pregnancy, and these ones which bring about cardiotoxicity and other side effects which we shall see here. Then the one which has medium acting and widely used anaesthetical anesthetic is the lidocaine. This one is the one which is widely used. It is widely used, and because it is a strong vasodilator, it is always given in combination with adrenaline. These drugs are given in combination with adrenaline, which is a vasoconstrictor. And this adrenaline, when given it in combination, it prevents systemic toxicity. The importance of combining lidocaine and adrenaline, which adrenaline, this one is a vasodilator, this one is a vasoconstrictor, it prevents systemic toxicity, because when it constricts the vessels near the localized area, it does not allow the lidocaine to move into the systemic circulation. And also it helps to prolongs the action of lidocaine. So those are the two reasons why we give them in combination. Even these ones we can give them in combination with adrenaline because they are vasodilators, so to bring about the vasoconstriction effect of adrenaline, but not given in people with the cardiac arrhythmias and fibrations or ischemic, because it can lead to death. And even hypertension patients, it is contraindicated to give adrenaline. So that is what we can talk about. Then another drug here we can list is prilocaine, and this prilocaine is part of the amides, and these amides, for them, maybe what I never told you, for them, these ones cause allergic reactions, but these ones, no allergic reactions caused by amides. No allergic reactions caused, and these ones, they are long acting because they are not metabolized by pseudocholinesterase. So prilocaine, this is another type of amide derivative which also has ability to cause methemoglobinemia. It causes methemoglobinemia by producing taurine, which oxidizes iron 2 to iron 3. And when the hemoglobin is oxidized, the iron of hemoglobin, it loses ability to carry oxygen, which leads to cyanosis. Cyanosis, it is bluish, the skin becomes bluish due to lack of oxygen supply. This one can even lead to hypoxia. So another peculiar drug which can cause methemoglobinuria is prilocaine. So prilocaine and benzocaine, they are a pair of drugs that cause methemoglobinuria. Very important to note. Then as I conclude, the other side effect we have not talked about, these drugs can bring about hypotension on cardiac. When they act on cardiac, they can bring about cardiac arrhythmias. And the peculiar of these long-acting amide, they bring about cardiac arrhythmias. These drugs can bring about seizures like cocaine. They can bring about sedation. Sedation can also occur. Peculiar of cocaine. Then this one is action on the CNS. They cause CNS depression. Then on cardiac, they cause arrhythmias and hypotension. Then other side effects we have seen is methemoglobinuria, hemoglobinemia. We have seen it. We have also seen they are teratogenic. They cause teratogenicity. And examples we have seen mepivacaine causing this. The drug which we can use in pregnancy, bupivacaine, can be given during labor to prevent pain during labor. So when the pregnant mother is in labor, we can give them bupivacaine, which is long acting, and it can prevent pain during labor. That is the drug, because it has minimal toxicity on the fetus. So this is what we can discuss under local anesthetics, where we have seen the mechanism of action which blocks the propagation of action potential, hence impeding the impulse transmission. We have seen the factors that enable the action of this drug is pH, pKa of the drug, size of the fiber, and lipid solubility. The more the solubility of the drug, the more it becomes potent. Then we have seen esters, which cause allergic reactions also due to PABA metabolite, which is always metabolized by acetylcholinesterase. And we have said because of that, they are short-acting and less potent. Then we have looked at the category where we have short, long, and superficially applied, like cocaine and benzocaine. Then the longest acting is cocaine, and we have seen benzocaine causes methemoglobinuria. Then we have seen cocaine, which apart from inhibiting conduction, it also inhibits reuptake, and it is the only vasoconstrictor. Then we have seen amides. For them, they do not bring allergies, and they are long-acting. And examples are these ones, but the longest is bupivacaine. Then the medium is lignocaine, and these ones are given in combination with adrenaline. And to enhance their action, it is even advised to give them with sodium carbonate. It is advisable to give them with sodium carbonate to enhance their action. Why? Because sodium carbonate increases the ionized basic form, hence increasing the action. So note that giving it with sodium carbonate is also a potentiator. Then we have seen the only drug which can be given in pregnancy during labor to prevent labor pain is bupivacaine, then ropivacaine, mepivacaine. We have seen their toxicity effect, then mepivacaine being teratogenic. So thank you so much for learning with us from the beginning until the end. We are always proud of you.